It's no surprise to anyone that healthcare is very expensive, but you probably don't know that for 2026, it's projected that healthcare costs are going to reach their all time high. So, given the high cost healthcare environment, employers are really looking at all aspects of their health plan in order to reduce cost, not only for themselves, but also their employees. One solution in the marketplace that is starting to gain some share is a product called Surest by United Healthcare. With Surest, the ultimate plan design eliminates deductibles and coinsurance, all those things that employees generally don't like, and replace it with a variable copay based schedule. Today, just in order to learn a little bit more about Surest, we have John Chabot, the VP of Sales at Surest. Hey, John, how's it going? Welcome to the show.
Hey, John, thanks for having me. I'm doing well. Excited to have the opportunity to spend some time with you to talk a little bit more about Surest today.
Awesome. So, John, before we really get into it, right? I'd really like our audience to learn a little bit more about you and what led you to Surest.
It's an interesting story. I actually spent more of my time on your side of the table as a broker consultant. And so I was in the broker consultant world for about 15 years. Started out at a family-owned agency for about 10 years, was the chief operating officer there, and had an opportunity to bring them through an acquisition with a large national firm. Spent 4 years there, never really saw myself leaving that national firm, but in walked a company by that time, or at that time rather, by the name of Bind. And so that was back in 2019, back then, still named Bind. And I saw a presentation on it and I thought, wow, this is something that's really unique, very different. The really interesting thing at that point in time, our book of business with that agency was a lot of nursing homes. And I would go into these nursing homes and we'd look at benefits for these people and they'd have a $2,500, $3,500 deductible. And my thought was, they might as well not have insurance. I mean, for them, meeting that deductible was unattainable. And I tried to work with the local carriers in our market to really try and come up with a solution to give them some upfront coverage to have them have affordable access to at least a little bit of healthcare, and nobody could do it. And so as I got to know at that time Bind, I realized, hey, this has no deductible, it has no coinsurance, and it really struck a chord with me. I thought this would be really good for folks in our community, especially these folks that are low wage earners like the nursing homes that we were working with. And so it was the first time in my career that I followed somebody out to the elevator. The gentleman that I followed out to the elevator happened to be the founder of the company. And so 9 days later, I was signing a contract with what at the time was Bind. And another story, renamed as Surest in 2021. And that's how I found my way over to Surest.
Very cool. No, I appreciate the background. So, you mentioned Bind and the name ultimately became Surest. So, how did Surest ultimately get its name?
Back in 2019, we were Bind when I first started there. In 2021, UHC came in and did a transaction with Surest. And so UHC has always had its hands in Surest. And so they put dollars into the venture capital fund that Surest actually came out of. And so credit to UHC for really understanding the market and knowing that something had to happen. We had to have some innovation in healthcare. I mean, we really haven't had any innovation in healthcare since the HSA, and that was back in the early 2000s. And so United put some money into a venture capital firm, developed this concept that became known as Bind. Ultimately, when they came into the marketplace and did a transaction in 2021, they thought, hey, we probably need to rename this thing. If you think of the word bind, right? Like, it's not a positive connotation, right? Like, I'm in a bind. Like, that's not a good thing and probably not something that you want to be in when you think about your health insurance. And so as it goes, people a lot smarter than me when it comes to renaming the company. We've got a great team at UHC from a marketing perspective and folks within Surest. We wanted to come up with something that led to what we really think about our value prop, and that's creating certainty, right? We want people to be able to go out and access affordable healthcare and have certainty in what their options are and how much the cost is going to be. And we think Surest really represented that philosophy of again, creating certainty in the marketplace.
No, really cool. Appreciate that, John. So I kind of teased it out right in the opening monologue, but really, ultimately, what is Surest and how does it vary compared to your traditional health insurance plans that are available in the marketplace?
Yeah, I think before we talk about what Surest is, I think it's probably worth talking about the problems that we tried to solve when we created Surest, right?
Sure.
So if you think about health insurance, definitely confusing, right? 4% of Americans can correctly define the components of their health plan. And it's worse than that. If you think back to elementary school where you had a list of words on the left and definitions on the right and you had to draw the line,
Yep.
that's what 4% of Americans can do with deductible, coinsurance, maximum out of pocket, so on and so forth. And so think about what we've asked of those same consumers. Hey, go out, be a good shopper, make good decisions, right? That's a really tough proposition to make when you don't even understand what deductible coinsurance is. And frankly, even if you can find the price, I don't know if you ever watched the show Smarter Than a Fifth Grader with Jeff Foxworthy. I'm
Yep,
probably
great
dating
show.
myself
Yeah.
at this point.
No, good show.
But people aren't very good at algebra, right? And with a traditional plan, if you think about, even if you can find a price of healthcare, to actually figure out what you as a consumer would owe, it's literally an algebraic equation. And like I said, we know we're not very good at algebra. So we know there's a lot of confusion that leads to people foregoing the care that they need. And then the other problem that we really look at is this concept of waste. And when I talk about waste, think about it in two forms: overprescribing, not necessarily just medication, but treatments as well, like knee arthroscopy, lumbar spine fusion, rather than just maybe doing physical therapy or a pain injection, chiropractic, right? To fix those ailments. So often we see that overprescribed treatment of surgical procedures when they're not necessary. So we see waste in that form. And then the other form of waste that we see is, frankly, just this huge variance in cost. No complication, no readmittance, no reworks, just huge variation in cost based on where we go for the same procedure. So with keeping those two problems in mind, think about Surest as a solve to those two problems. First off, how do you get rid of confusion? Well, you eliminate the confusing components of the health plan. Surest doesn't have deductible, doesn't have coinsurance. And when you strip away those two components of the health plan, what you're left with is really a copay only plan. Our members, frankly, come to see those as prices. And what those prices allow us to do is vary the price depending on where people go and what they do. And so you could kind of boil Surest down into this one statement, not to oversimplify it, but we reward members with lower prices or lower copays for utilizing high-value providers and high-value treatments. I would say there's a couple things about the benefit that are really cool that I always want to make sure people know about. First off, we do have an out-of-pocket maximum. For whatever reason, when we tell people it's a copay-only plan, they think, well, those copays must be able to add up to infinity. Not the case. We do have an out-of-pocket maximum that those copays accumulate towards. Those copays have ranges. And depending on the plan design, they can be lower ranges or higher ranges, but within any plan design, there's guardrails. So for an office visit, for instance, on kind of a middle of the range plan, you'll see an office visit range from $20 to $100. So even if I don't go on our app, I know that if I have an office visit, it's going to range between $20 and $100. Most people meet us on the app because they want to know exactly what that cost is going to be. And when I come to the app, I can see that if I go to a high-value provider, I'm rewarded with a lower copay or a lower price, as I had mentioned. And so that's really the crux of it, is trying to get folks to utilize those high-value providers by rewarding them with lower prices, not just for physicians, but also treatments as well. And so when you think of rewarding members for using high-value treatments, with a Surest plan, you might see a really low copay on things like mental health, physical therapy, speech therapy, those things that we really want people to utilize that we know are really valuable to their well-being. We lower the copay. And so it's really interesting with this copay only plan, what it allows us to do is actually change the subsidization based on the actual therapeutic class. So pretty cool on how we can actually change that subsidization on a therapeutic class.
One thing that you said, right, and I heard the word consumerism, right? So it sounds like you guys with Surest are redefining how consumerism is, right? And that does remind me a little bit of when the high deductible HSA plans that you mentioned before came out, many years ago, right? And the original promise of those plans was that, through consumerism, we're going to reduce the cost of healthcare for all, right? And maybe on the fringes, right? Maybe you have some redirection from ER to urgent cares, what have you, or some elective surgeries. But in general, those consumerism savings really and candidly didn't materialize. Why do you think that was?
Yeah, it's a great question. And I would say brokers, consultants, as well as plan sponsors have grown skeptical, right? Because they've heard this before that, hey, if we can get people to be good consumers, that it can save money for both the consumer as well as the plan sponsor. And that was the promise of high deductible health plans with HSAs. There's a couple of components with a high deductible health plan and HSA that I think we're missing. First off, I remember as a consultant going out and talk to employees and saying, hey, be a good shopper, go out, see how much things cost. If you've ever tried to do that, it's really challenging,
Yep.
right? You get in this loop of like, well, it depends on how much your insurance covers. Well, it depends on what they bill, right? And so it's really challenging for consumers to go out and actually find out what things cost. So that's a challenge. The second thing is, I don't know about you, but I think back in 2000s, early 2000s, I think I was carrying a Palm.
Yeah.
Tech was not where it is today, right? Yep. I mean, with the with a Palm, I don't think I could really go online and actually do any shopping. I don't know that apps even existed back when HSAs were born. And so the tech really wasn't there to support the shopping experience, and nor was the big data. And so when you think of big data, we were asking people to go out and shop. It was really based on asking questions. Did consumers really know the right questions to ask on whether or not it was good quality and cost efficient? Probably not. And so it really was kind of a guessing game without, again, having good technology and big data to support that concept of consumerism. The second thing I would say is really, if you think about HSAs, there's a misalignment of plan design and incentives. And so when I say that, if you think about an HSA or even traditional plans, oftentimes it doesn't take much more than a $5,000 or a $10,000 claim to hit your out-of-pocket maximum. And so oftentimes those things that we want people to search for and find the most efficient doctors, the members have no incentive to actually do so. They're going to hit their out-of-pocket maximum regardless of where they go, right? And so to that end, I think a lot of times then people think, well, I must get more if I pay more. And if it's going to cost me the same regardless of where I go, I might as well go to that facility that charges $180,000 versus the one that charges $40,000. Because the last time I bought a car, I paid a little bit more. I got leather.
Yeah.
I got a sweet sound system. And so
Yep.
I think people have that perception when we know, unfortunately, that it's that an inverse relationship. Cost doesn't mean quality in this industry. And so what we did with Surest is really align the incentives for members. As a member, when I go on our app and I see a lower cost, I'm incented to utilize that particular facility or provider or service. As I am rewarded with a lower cost, my member, or my plan sponsor rather, is rewarded with a lower cost of total cost of care as well. And so we've just simply aligned the incentives for members with we've aligned the incentives for members with the interests of the health plan. And we've made it really easy for members to be able to see that via our app or being able to call in and get that same information.
No, very cool. Yeah, at some point later on, definitely want to see a demo of what the Surest member experience is like. So if you're willing to do that, we'd love to see it.
Yeah, absolutely. We'll demo. I would tell you it's where the rubber meets the road, right?
Yep.
Members get in there. They can see. The really cool thing is one of the misconceptions with Surest and the app, and I'll just throw this out there. Oftentimes people think, well, this must only be good for my folks that are young, that walk around with their heads down on their phones all day, and it's far from the truth. We actually, when we take a look at our book of business at Surest, we're older than the commercial book of business. And so that's a misconception that I think a lot of people have about Surest being tech forward. And so one of the things that we've really seen when it comes to Surest is the people that navigate towards Surest are those folks where that deductible is just no longer working for them. Whether that be low wage earners or whether it be folks that are living paycheck to paycheck. And we all know you don't have to be living paycheck or being a low wage earner to live paycheck to paycheck.
Yep.
Right. And so we see those folks gravitate over to Surest because we don't have deductible. We don't have coinsurance. We give them that certainty where they can see exactly what things are going to cost prior to actually getting that service.
So one thing that you said before, right, with the HSA plans, I mean, last year, my wife gave birth to our son, John the Fourth. He's 8 months old now, doing great. But my wife and I were joking around that once she delivered, birth to our son and everything went well, generally, that, hey, go out and get whatever you need done because we had our out-of-pocket max and healthcare is free. So the element of consumerism with that traditional HSA plan totally went away.
Yeah, it does. Well, congratulations, by the
Thank
way,
you.
and great name. I love it. Good to see the name carrying on. But you're right, and we see this, and plan sponsors see this when you get to the end of third quarter, the end of fourth quarter, right? You see that plan spike. Members hit their deductible, they hit their out-of-pocket maximum, and I, as a member, like you just mentioned,
Yep.
I might do things that I wouldn't otherwise do once I've reached my out-of-pocket maximum, which is interesting. With Surest, there is no one copay that allows a member to hit their out-of-pocket maximum. It's very intentional for two reasons. One that you just pointed out, to protect the plan, We don't want people to hit their out-of-pocket maximum. We want them to stay engaged in their healthcare journey throughout the year. And so as a result, like I mentioned, no one copay that allows a member to reach their out-of-pocket maximum. But it's also there to protect the member. I don't know about you, but insurance doesn't feel much like insurance when I have one claim and I just hit my out-of-pocket maximum. That doesn't seem
Yep.
like financial protection. And so again, we do it for two reasons: protect the plan sponsor, but also protect the member as well.
So just going a little further on that, right? So I've seen a number of studies come out from Surest, right, that have been published that ultimately show that for plans that put Surest in, on average, I believe they save about 15% per year compared to traditional insurance, and that member out-of-pocket costs are reduced by about 50%. Why is that?
It's a really good question, and I would tell you one that we've battled because it sounds too good to be true,
Yep.
right? And it is. I mean, I would tell you it's a great question because we talked about skepticism a little while ago with HSAs. People have grown skeptical. Too good to be true. How can a plan sponsor and member save at the same time? And so really it comes down to the benefit design that I talked about and solving for those problems that I mentioned at the beginning. A big part of that being that waste. And so it is interesting, even within the same network, we can see, for example, a lumbar spine fusion vary in cost from $40,000 up to $180,000, just depending on where we go. And so when you start to eliminate some of that waste and reward members for utilizing those low cost, efficient, very effective facilities, but at the lower end of that cost spectrum, all of a sudden that creates a lot of savings for the plan, because who's paying that difference from that total cost of $40,000 to $180,000 plan, right? And so when we start to bring that total cost of care down, plan sponsor wins. We reward member for utilizing those efficient, low-cost facilities and treatments by rewarding them with a lower copay. So member wins when they choose a low-cost, efficient location by having a lower copay, and in turn, the plan sponsor wins as well. However, I will tell you, one of the really big keys of Surest is just not moving members to the low-cost site of care. It's actually eliminating that waste. Meaning, when we get folks aligned with a high-value provider, we tend to see less surgical procedures. We see less of that waste. So now all of a sudden that $40,000 or $180,000 lumbar spine fusion becomes a physical therapy. It becomes a pain injection rather than an expensive, invasive surgical procedure. And so as a result, across our book of business, we see about a 15 to 20% reduction in surgical procedures. That's where we see a lot of savings with Surest.
Interesting. And just to be clear, right? So with Surest, it is still based generally on the broad UHC network. It's not a narrow network solution, right?
Yeah, not a tiered network, not a narrow network. Like you mentioned, it's UHC Choice Plus, which is UHC's largest, broadest national network across the country. And so this is not a play on an ACO. It's not a play on getting folks to just a select set of doctors. We're going to give them access to the largest, broadest network within UHC, but then give them a good tool to make good choices within that large, broad access network. And when you give people a good tool and you give them clarity, you'll be surprised at how often they choose those high value providers and actually migrate towards those efficient care options.
So speaking of that, right? So I've spoken to many clients and prospects about Surest, and it seems to be the most common criticism is, John, I love the savings, but how do I actually put this in an open enrollment guide? Like, what am I going to do?
Yeah.
List all these, variable copays? What would you say to the average employer out there who's looking to communicate this effectively?
Yeah. Well, first off, I would say look at what you're doing now. Deductible coinsurance, 4% of Americans can define that. We're not good at algebra. It is completely opaque. I mean, if you look at insurance now, I haven't heard anybody say, give me more deductible, give me more coinsurance. I'm loving that world, right? And so I would say that's probably more confusing than at least giving them a structure of copays. But really, how we come to market in open enrollment is let's let folks test drive the experience. And so during open enrollment, we think the best way to educate folks is to let them into that member experience, let them test drive it, go and shop for things that you've had take place in the past or maybe that you have upcoming, and see exactly what that member experience looks like. Through that experience, we can show the member exactly what the cost is going to be for the services that they maybe are going to encounter as a member, and they can again see exactly what that experience might be like for them. That's how we think the best way to learn is to test drive.
What would you say the target market is for Surest, right? Are you targeting just the jumbo employer, self-insured? Do you target smaller, fully insured employers? What would you say, John?
I'm really excited. We just rolled out our level funded option, which allowed us to come down to the 2+ market. And so we think our level funded option is a great way for small, mid-size, and even large employers to look at Surest. We've got fully insured options for 51+, 100+ in some markets, and then ASO. So across the funding spectrum, we can help employers. I wouldn't say there's necessarily an industry that has really migrated over to Surest. I've seen, again, across industries, Surest be a great solution. What I have noticed, and I mentioned this earlier, it seems to be those folks that are low wage earners or those folks that are living paycheck to paycheck. And I think just about every employer has a segment of their population that struggles with deductible coinsurance. I mean, heck, John, if you look at the median household income in the US, it's around $80,000. We know that there's people out there that unfortunately that high deductible is just not working for. And at that point, I would ask an employer, do you think that that benefit is actually helping attract and retain your talent? A lot of your folks don't even feel like they have insurance with $1,000, $2,000 deductible. And so again, kind of that segment that we've seen is more so based off the population that sits within those employers, not necessarily an industry type.
There, where do you ultimately see Surest going in the next 3 to 5 years?
Yeah, it's great. You know, we got really lucky by being aligned with UHC or being absorbed by UHC. UHC is a very innovative company. And so one of the really cool things that's happening is we're taking a look at Surest and traditional UHC products, and we're cross-collaborating, right? Taking that innovation from Surest and applying it to different ideas and different technologies within UHC to bring that same customer experience to other traditional products. So that's really exciting to see that momentum and that shift, that consumerism really coming to fruition for those UHC products. With Surest itself, I think you're going to continue to see us build on our promise of being a very consumer-centric product. Things like in-app payment hopefully will come to fruition where, think of that, right? I can come onto the app, I can choose a provider, a service, and actually just make my payment and be done with it. In-app scheduling, things like that, again, just to be more member-centric for those employees to be able to go out and navigate the healthcare consumer is really where I see it going.
And that's really cool, right? I mean, just with, doctor bills, the babies, right? Like I'll get a bill 3 to 6 months later, and I'm looking like on my, health insurance app, I'm like, is this the actual like amount? But I think that's pretty cool that there is the option to pay, and then you can kind of verify that the amount the provider is charging you is actually correct.
Yeah, I mean, true story. When we had our kids, I've got 3 boys, and I remember when we had our first child, I was not on a Surest plan. That was way back in the early 2000s when we had our first boy. He's 18 now and getting ready to head off to college. But my wife came up, and we were on an HSA plan at that time. And my wife came up, and she's like, I'm getting all of these EOBs. I'm getting all of these bills. I have no idea what to do. And I had been in the industry for a few years at that point, and in my infinite wisdom, I said, honey, everybody knows. You just wait till it goes to collections. That's when you know. That's when you know you should really start paying these bills, right? Because nobody can figure it out. It's so hard to match it up. It's hard to know who, when you should pay. And that was my suggestion to her.
So one additional question I get just from some of my clients and prospects, right? So we do know that point solutions are still a thing in the marketplace, right? And I believe my personal take is certain point solutions can be a great fit for an organization depending on what their goals are. You mentioned before surgical centers of excellence, right? And getting surgery done at the right place. That could be a good fit for certain organizations. So does Surest work well with certain point solutions? And I guess to that extent, third-party PBMs?
Yeah, great question. We do have a host of point solutions that we work with. The really cool thing with Surest, if you think about our ability to actually help folks navigate the healthcare system, we can be very suggestive in point solutions as they search on a condition. So what do I mean by that? Maybe I'm somebody who's encountering a maternity claim. When I go into Surest and I do a maternity relevant claim, we can actually put those point solutions right in front of folks. Maybe I'm somebody that suffers from chronic back pain. If I search for physical therapy or back pain, again, I might see a point solution specifically aimed at chronic pain conditions, right? And so our ability to navigate or help folks navigate to the right point solutions is really good. Even think of things like, for example, virtual care. Doctor on Demand is a great example that's embedded within the Surest solution. And as I search for things that might be relevant for virtual care, it shows me that that might be a good option for me. So if I search for pink eye, sore throat, maybe with the intention of doing an office visit, I'll see Surest present an option for virtual care. And so we see way higher utilization of those point solutions by simply putting them in front of folks at the right time. And that again drives that utilization of those point solutions. As far as PBMs, we are expanding to PBMs outside of our embedded solution. And it's exactly that what makes it, I would say, both challenging, but also really, really consumer centric for Surest, is embedding that point or that PBM into the member experience. And so what I mean by that, with our embedded solutions, I can actually see what the cost of that prescription is going to be. I can see it accumulate towards my out-of-pocket spend. And there's a lot of work to do that with a PBM. So integrating that into a member solution gets to be a little bit challenging. And so we don't have this open book of PBMs that we can work with, but we're continuing to expand the options with PBMs as we encounter them.
Fair enough. So, John, one thing that I'm also seeing among my book of clients, it seems that high cost claims are really on the rise. And it seems that the $1 million claim, which was very rare in the past, now seems unfortunately all too common. So, I'm of the belief that certain high cost claims can certainly be targeted with early intervention, but others, just unfortunately happen. Is there anything that Surest can do to help employers mitigate the risk of high cost claims?
Yeah, you brought up early intervention, and I agree. I mean, when you think of just having early intervention, we know that that reduces the total cost of that care. Catching cancer at stage 1 versus stage 4 reduces the cost. The unfortunate part is we talked about deductible being a barrier to care. We know that people delay care. We know that people avoid care because of the cost that's associated with high deductible health plans. With Surest, again, pointing to that high value care, office visits are super affordable. We want people to engage with their primary care physicians. With no deductible, just having an office visit copay and providing folks that certainty, we see a lot more utilization of both preventive care as well as primary care. With that comes that early intervention. And so we haven't been around long enough to really measure what early intervention is doing for capping those high cost claim amounts. But I do believe philosophically, by making healthcare more affordable and accessible to folks and getting that early intervention, that ultimately we will reduce the cost of those high cost claimants, or frequency at least.
Awesome. So, John, if you don't mind, I would love to see a demo of the employee experience.
Yeah, absolutely. I will tell you, the employee experience is really where the rubber meets the road. And so let's jump in and I'll show you exactly what that member experience looks like. All right, so jumping into a demo here, the first thing I'd want to mention is this isn't actually our app. This is our pre-member site. And you might be asking yourself, well, what is the pre-member site? We mentioned the best way to get folks acclimated to or to learn Surest is actually just to jump in and test drive it themselves. And so this is what our folks have access to during open enrollment. They can come in based on the plan design that their plan sponsor has chosen, and they can do some searches on things that maybe they've had in the past or that they have upcoming and see exactly how Surest will work for them. So I'll just do a couple of searches to get folks acclimated here. First off, you can see these are active buttons on the bottom. I can simply click on medical office visit, and I'm presented here with a number of choices. First off, I can see that medical office visit starts at $20, but you'll also notice others felt better with trying to keep that language really easy and familiar to what maybe they've experienced during other shopping experiences. And so right from here, I can see that instead of spending $20 on an office visit, I've got an option for free care. And in this case, I've got 3 options available to me for virtual visits. Very different than how we put those virtual visits in front of folks with traditional plans. If I decide I want to make an office visit, I can certainly do that. I simply click on Find Providers, and now I've got, again, that power of that Choice Plus network within United Healthcare working for me. You can see within 2 miles, I've got 83 results. I'll go ahead and just really quickly show you some of the filters that have been very popular with our members. First off, you can see we can sort by some common things like lowest price, closest, highest rated. And as we go down, we've got a number of other options available. Distance, I'll zoom out just a little bit on this search, just again to show the power of that Choice Plus network. But then I can look at things like a specialty. So if I wanted to look, for example, for an ear, nose, and throat doctor, I could do that. Again, we'll leave it open. Sex of the doctor, we can specify that as well as the ratings. We do piggyback on health grades, so we can actually narrow that search down by the health grades rating, which I'll point out again here in just a moment. I can also search by language. You can imagine how tough it would be to have an effective office visit if my doctor doesn't speak my language. And so, again, trying to remove those barriers that folks oftentimes run into when seeking medical care. And then finally, at the bottom, some convenience factors like accepting new patients, offers telemedicine, and extended hours. Like I mentioned, I'll leave it really broad. And now you can see we moved from 80 so doctors all the way up to 144 within 5 miles of that specific zip code. I can easily change that zip code if I wanted to search in a different area, but we'll just leave it on that zip code for purposes of time. And as I scroll down, now I can see the copay as well as the doctor. Again, as I click into a particular doctor, a lot of those same things that you saw come to fruition on that search or on that filter. And so as I look down, I can see our Surest Care rating. I can see contact info. And so you can imagine if I was on my phone, which is how most people meet us, I could simply click on that telephone number, schedule my appointment, and away I go. From here, I can see the Surest Care rating. Scrolling down again, you see that health grades rating come to life as well. And so think of that as far as a rating as to what others in my community are saying about this particular physician. Really helpful for our members. And again, just another way to help them understand the care as well as the quality that they're receiving from particular doctors in their community. Scrolling down again, those nice to knows, right? Demographic, you saw that in that filter, speaks English, in this case, female, in network, accepting new patients. And now again, I can see education if it is specified, which in this case it's not. And again, a gentle nudge to that virtual acute care. Medical office visit, although a very common search, is pretty simple. So let's back up here and do a new search. And so I'm going to do something. One of the things that's really cool about Surest is we can actually search by condition. And so, being somebody that suffers from chronic back pain, I'll show you how simple it is for someone to search based on an actual condition. And so, the reason that we want folks to do this, when we get them to search based on a condition, it actually gives us the ability to prompt them with some information like a relevant treatment path. And so, you can see I can click on back hurts. If my back hurts, I probably am going to start out with a medical office visit or a virtual acute care. One of the really cool things when we get folks to search based on condition is we can actually return curated results. And so in this case, you'll start to notice that orthopedic surgery, sports medicine start to come into search. Again, those folks that actually treat back pain, we can curate a list based on that condition search. So pretty cool how we're able to, again, put very relevant information in front of folks based on that condition. The other thing I want you to think about, if my back hurts, I'm on a traditional plan, I might not know the options and the cost available to me as I navigate the healthcare system. And so with Surest, you start to see if I've got back pain, probably pretty common, that I might do an x-ray. In this case, I see that that x-ray is available to me at $0. I might also have to do an MRI down the road. And right from there, I can see before I ever leave the comforts of my home exactly what the cost is for that MRI. In this case, that starts at $125. If I've got back pain, probably pretty common that I'll do one of these particular therapies, whether it be physical therapy or acupuncture. Again, presenting those options based on that condition, really easy for our members to understand their options as well as their costs, all the way down to minor procedures and major procedures. And finally, you do see those point solutions come into play. Again, in this case, Canary Health, which is a chronic condition self management program, putting those relevant solutions in front of folks based on that condition that they've searched for. As I click in to a particular procedure, in this case, a lumbar spine fusion, I can again see exactly that price based on where I go. One of the things that we had mentioned earlier was this concept of, well, what's included in that copay? And we like to make it really easy for our members, just pointing out here at the bottom what's included. And again, I see as a member that copay doesn't just cover the doctor, it covers the doctor, the anesthesiologist, the facility, all of that's included in that copay, making it really easy for our members to know exactly what they're going to pay before they ever leave the comforts of their home. Just a couple of quick searches to really bring that plan design and the conversation to light. Hope that everybody can have a chance to get in there and experience it for themselves.
So, John, yeah, that's a really cool demo. Thank you so much for showing it. I definitely learned a lot. And, it's great to talk about Surest, but you also have to see what it's like. And like you said, here's where the rubber meets the road. So thank you for showing our audience that.
Yeah, absolutely. And I would tell you, I would encourage plan sponsors that are considering Surest to get in, meet with their broker consultant, get in access to our demo. One of the best ways to learn Surest is just to get in there and test drive it yourself. And so definitely would encourage folks that are watching this to reach out to their broker consultant, to you, and get access to that demo.
So, speaking of which, John, let's say there's an employer out there or a broker consultant and they want to learn more about Surest. Where can they go?
Yeah, great question, John. Well, first off, people can check us out at surest.com. But really, people should think of us as another plan option that sits within the UHC portfolio. And so, as such, they can contact folks like yourself, broker, consultant, who can reach out and get a quote for Surest through their UHC account executive.
Well, John, thank you so much for coming on the show today. Really learned a lot. So, thank you.
Yeah, John, thanks for having me. Great opportunity. And it was nice to spend some time with you today.
Now, we want to hear from you guys. If you're an employer, would you consider rolling out Surest for your employees? And if you happen to be an employee and you're enrolled in Surest, what has the overall experience been like? Comment below.